Thank you, Jamal, and good morning, everyone. Thank you for joining us very early today to talk about food bank operations. And as Jamal said, I'm Lauren Davis. I'm from North Carolina A&T. I'm here with my collaborators, Iram Single Urgut from University of Alabama, and Stephen Jang, also from North Carolina A&T, but we'll be presenting this today. And it's important to point out that we did this tutorial in partnership with our food bank collaborators who are listed here, representing the Food Bank of Central and Eastern North Carolina, the Second Harvest Food Bank of Northwest North Carolina, as well as the West Alabama Food Bank. So I'd like to acknowledge that our work has been funded by NSF and also acknowledge the support of our food bank collaborators. So first, I'd like to just set the stage for the talk by talking about hunger in the U.S. And so, as of a recent report by the USDA, approximately 14% of U.S. households are food insecure. So if you've heard the term well, some of you may not have heard the term food insecure, so I'm gonna tell you what that means. And it basically defines a lack of consistent access to nutritious food for an active and healthy lifestyle. So when you think about this percentage of 14% U.S. households, what does that look like in terms of people? That's roughly 47 million individuals and also comprises 1 in 5 children. So when we think about what the food assistance landscape looks like, there are several key players both at the national, regional, and local level that work together to provide food assistance to people in need. And so on this top layer, you'll see several key players represented: the USDA, emergency food organizations, food banks, and food rescue programs. So food rescue programs primarily recover perishable food, also food from community service organizations, and also think about prepared meals, so things that are hot and can need to be distributed immediately. Then when we think about USDA programs, the USDA programs actually provide assistance in 2 forms. So they first provide assistance directly to individuals in the form of SNAP or WIC. So SNAP is a Supplemental Nutrition Assistance Program, which provides EBT cards to individuals so that they are allowed to purchase food of their choice at a grocery store. And then they also provide additional nutrition support services as well. Additionally, the USDA also provides commodities through something called the Emergency Food Assistance Program, which is called TFAP for short. And so those commodities are purchased through U.S. growers and producers and made available to larger hunger relief organizations to distribute to local organizations to eventually get to people in need. So we're going to focus this talk on food bank operations. So if you have never been to a food bank, I wanted to first start by showing 2 pictures here of food bank warehouses. So the one on the left is a warehouse in North Carolina from Second Harvest Food Bank, actually. So I want you to take note of how large it is, the volume of food that they're dealing with, and the packaging of the food. They deal with food banks primarily are nonprofit hunger relief organizations. They collect, store, and distribute surplus food, and they work with large, typically bulk donations. And then they also, in addition, have to take those large donations and break them down into smaller sizes to be distributed to households. This is usually done with volunteer resources. So you can see in the picture that there's a large donation that has been received of apples, so eventually volunteers would have to go through that particular box, sort out the food, determine what's edible, what's not, and then prepackage that. So given that context, let's now talk about the supply chain structure. So typically, you have a food bank warehouse that's getting donations from a variety of sources as depicted here in this picture. So they can get in-kind donations from retailers, food manufacturers, so think grocery stores, and what they're getting is food that is close to the sell-by date, but it's still safe for consumption. They can also get edible food from donations from farmers, and primarily the food banks we're going to be discussing are affiliated with Feeding America. So as being a member of the Feeding America network, they have access to large donations within the network as well there. Additionally, food banks can receive financial donations as well as in-kind donations from the community, people like you and me who decide we want to organize food drives and give food to the food bank. And also, as I mentioned before, the in-kind donations are coming through TFAP. And I should also mention too that at least in North Carolina, the state allocates funds to the food banks to use to purchase food to help supplement the in-kind donations that they're getting. So those food donations are then distributed through what's called a partner agency network. So that partner agency network examples are listed here. So you can see there's soup kitchens, food pantries, child nutrition programs, school pantries, et cetera. There's lots of different organizations that food banks partner with because they're trying to make sure they can meet the diverse needs of the population that they serve. So that ranges from children all the way up to seniors. And what you'll notice here is that the individuals who are in need of food assistance, they are getting food assistance through the partner agency. So generally, most food banks do not have individuals come directly to them to get food. Things are changing a little bit in terms of this distribution model, as I'm going to show in this particular slide. So generally, like I said, there's a warehouse, supplies are coming into the warehouse, they're being sorted and then distributed through the agency network. But food banks are also configured differently. So for example, food banks can have multiple branch warehouses, and those branch warehouses can be designed in such a way that they are targeted to serve agencies in specific counties. So they may partition their particular service area based on counties and then primarily allocate food to those counties through different warehouses. Another way that food banks can distribute food is depicted by this flow here from vendors directly to the partner agencies. So for example, as an example, the Food Bank of Central and Eastern North Carolina contracted with a vendor to provide produce boxes directly to the partner agency. So that's another mechanism by which they can supplement the in-kind donations with more fresh, nutritious food. The second flow depicts a relationship or distribution between the donor and the partner agency. So an example of that is what food banks call the retail recovery program. So what they do is eliminate themselves as a middleman. So instead of having the food flow from the supermarket to the warehouse, to the partner agency, to the food insecure individual, what they will do is match partner agencies with retail stores that are in close proximity so that the partner agency can then just pick the food up themselves and then distribute it directly to the individuals in need. And then food banks are recognizing that they have gaps within their partner agency network, which they try to directly address through mobile distribution efforts. So they will, and I'll talk a little bit more about that in a subsequent slide, but that's one way of, instead of people trying to access food through partner agencies, food banks are using strategies to move the food closer to the people in need. So there's a lot of interesting features about this particular supply chain that we get excited about as ORMS researchers. So in the words of one of our collaborators who's from the Second Harvest Food Bank, he has said for a significant part of our inventory, we do not know what we will receive, right? So that speaks a lot to the push nature of this particular supply chain. Additionally, on the demand side, so remember I talked about and defined what food insecurity is, and many food banks look at food insecurity as a way to understand what the need is in their community. And so when we think about that from a supply and demand perspective, we see a lot of variation in the demand. And this graph here is showing the USDA food insecurity rate over time. So you can see that it's varying over time. And additionally, food insecurity changes geographically. So for example, states, in this map what you're seeing is the deeper red corresponds to states that have food insecurity rates that are above the US average, whereas the lighter yellow corresponds to states that have food insecurity rates that are below the US average. So the key takeaway here is that not only is demand changing over time, demand is different geographically and across the US and even within the states. So this is a map of the state of North Carolina, and you can see food insecurity rates varying significantly across the counties here, right? So you may see darker colors in the areas on the coast and also the rural areas in the mountains, where the more urban areas, there's less or lower food insecurity. So when we think more broadly about the characteristics of food bank supply chains, right, I've already showed you how there's uncertainty in the demand, both spatially and temporally, and there's uncertain supply, and that uncertainty manifests not only in just the frequency of donations, but also in the type of donations received, the quality associated with the donations they received, whether the type of donors and the frequency with which those donors are going to provide food or monetary donations. We also are dealing with a system that has many different types of products that are being donated. As I mentioned, the products are close to their sell-by date, so that indicates that the products need to be moved through the system very quickly, and they have varying shelf life. Another key component or key characteristic of this food bank supply chain is the fact that there's a large reliance on volunteers to help them with their mission, right? So if you recall the picture I showed in the beginning where there was a large box of apples, those apples need to be sorted and identified as edible, non-edible, and then prepackaged. And so there's other prepackaged type of activities that food banks do that require volunteer resources to assist with. And then storage capacity is also a big issue. So if we think about storage, we can think about storage capacity at multiple levels. So just at the food bank level, if we want to be able to provide nutritious food to individuals in need, we need to make sure that we have freezer and refrigeration that will allow fresh frozen food to be stored and eventually distributed. That's only one piece of the equation, right? So now we have to think about the receiving capacity of the agencies. Do the agencies have enough freezer or refrigerated space to take in that food and then distribute it to people in need? So you have capacity constraints on both ends that impact the distribution of food. So overall, we're dealing with a very highly constrained environment, and it's constrained at multiple levels. So we have resource constraints in the form of labor, we have infrastructure constraints in the form of physical capacity, and we also are dealing with financial constraints that limit the ability to supplement the donated food with purchased food. So now let's talk more in detail about the structure of our particular partners as a way for you to understand the differences in the different food banks. So we'll first talk about the food bank of Central and Eastern North Carolina, which we abbreviate FBC-NC. And so you can see here, their vision is that no one goes hungry. They serve 34 counties within the central and eastern part of the state. Several of those counties are on the coast, so Wilmington, New Bern area. And you'll notice that they operate a structure where they have multiple branch warehouses, which is indicated by the white stars in the picture. And so the coloring in this particular map is a direct representation of that allocation that I mentioned before of counties being partitioned to particular food bank branches. So for example, the Raleigh branch would primarily serve counties that are identified in the green area, okay? Serve counties and subsequently partner agencies. So they have a very decentralized kind of structure here, but also the Raleigh branch is the largest branch warehouse that they have in terms of capacity and serves as the hub. So now if we look at Second Harvest Food Bank of Northwest North Carolina, they primarily serve counties in the western part of the state, 18 counties to be exact. Their vision is food secure and healthy communities. And a lot of their counties are rural and in the mountainous region of the state. And so up until recently, they operated one warehouse to try to serve all of the different partner agencies within their network, which necessitated some interesting strategies for how they wanted to make the food more accessible to the partners that are part of their network. So one example of how they tried to do that is through offering rural delivery options. They have one partner agency that's roughly like an hour, almost an hour and a half away. So you can kind of get a sense for how the structure and geographic composition of the service area is going to influence the type of distribution strategies and policies that are going to be put in place. And lastly, we have the West Alabama Food Bank, which operates also one warehouse, and their mission is to alleviate hunger and food insecurity in West Alabama, and they service 9 counties within that particular area. So if we try to break down the distinctive characteristics of food banks, we thought about this from 3 perspectives: from the structural perspective, the capacity perspective, and then the population served. And we have several dimensions that we've used to kind of differentiate these things. So when we look at the network structure, so you can see here, as I showed in the picture, the number of warehouses, 6, 2, and 2, for FBC&C, Second Harvest, and West Alabama respectively. And as I mentioned, up until approximately maybe 2 years ago, Second Harvest only had one warehouse to service their entire area. So they've recently opened up a second warehouse in Guilford County to help them reach neighbors in, and I shouldn't have said, well, neighbors in need is kind of what the term they use for food insecure population, but to help them reach neighbors in another part of the region that had a difficult time accessing their warehouse. And then you can also see, in terms of the county served, the composition between urban and rural, right? So if you look at West Alabama, for example, of the 9 counties that they serve, 8 of them are classified as rural, right? In contrast with FBC-E&C, who 27 of their 34 counties are classified as rural. You also can get a sense for how large the service area is. And then one of the things when I first started working in this area that was really sort of astonishing to me was the size of the partner agency network, right? So people have talked about, oh, I've volunteered at a food bank, but you don't, until you kind of really start talking to them to understand the scale of operations that they do, is really quite amazing. So you can see FBC&C has more than 700 plus partner agencies and programs within their network. So that's a lot of coordination that has to happen to distribute food, to collect and distribute food to people in need. So if we think about capacity, right? So we can think about capacity from multiple perspectives as well. From the meals distributed, so typically in this environment, a metric that's used a lot to understand the efficacy of their efforts is looking at pounds of food distributed. So, and they can equivalently look at that in terms of meals distributed. So you can see here, just from fiscal year 2022 to 2023, the difference in the meals distributed. So that gives you a sense for how much is flowing through their network and the infrastructure they have in place to support that, right? As well as capacity from the labor perspective, so staff size and volunteer hours. So you can again see the difference in scale between FBC&C on the far end, right, and then West Alabama Food Bank on the other end. And then lastly, if we look at revenue, so it's important to note, so these are nonprofit organizations, but for tax purposes, revenue corresponds to the dollar value of the food that's actually being collected, as well as the monetary donations that are being collected. So those things together constitute revenue, and their ability to be able to take that and distribute that throughout their network speaks to the financial capacity and health of a particular organization. And also, I point out here that FBC&C, in terms of their revenue, is ranked 9th. So in terms of the population served, you can see here, and you're kind of hopefully getting a sense for FBC&C is very large. West Alabama Food Bank is smaller in comparison, but there's some interesting things to point out here by the pictures that you see in the bottom. And I don't want you to focus so much on the very teeny tiny text that you cannot see, but on the colors in the graph, right? So the darker the shading is an indication of the fact that that county has a food insecurity rate that's above the US average. So what do you see from the perspective of West Alabama Food Bank? Every single county that they serve has a food insecurity rate that's above the national average. Additionally, they have a higher percentage of food insecure children in comparison to the other particular food bank service areas. And they have a higher percentage of individuals who do not have access to a vehicle, which means their population is largely transportation insecure. They have a high number of people who are considered transportation insecure. So again, there's differences across these different food banks, which speak to the fact that this particular saying that we hear a lot in the food bank community. If you have seen one food bank, you've seen one food bank. So you can't just go to a food bank and generalize that to every single other food bank. Everyone is unique, and in the words of our food bank partners, they have their own personality, right? So you have to get a deep understanding of what the environment is like that they're working in before we can kind of come in there and recommend and suggest, some of our fancy tools that we like to develop. Yep. Sure. So there's some things that are similar. So like, for example, that retail recovery program that I mentioned where they try to match the agencies with the stores so that they don't have to, the food bank doesn't have to go pick up the food. That's pretty universal. Like I've seen that in most of the food banks that I've worked with. But what is different is actually one of these things I'm getting ready to show is the way they do mobile distribution. So FBC&C, so when we think about mobile distribution, and we've seen a lot of research recently where people are talking about mobile pantries and whatnot, that word of a mobile pantry has a different meaning in each of the food banks, right? So if I start with FBC&C, for example, they do what's called a pop-up market. And so that picture, although it's pretty small, what they do is they go and drive out into the community and set up something that looks like a like a farmer's market, and then they allow people to shop there, right? So and I use shop sort of air quotes, so you can select the items that you would like, and of course the items are for free. And then if there's any food that's left over, then they take that food and give it to a local partner agency that was in their network. So they drive the truck back to the warehouse empty, right? In contrast, let's look at Second Harvest. They operate, so for them, they have a mobile pantry, but this is like a van, and people come into that and shop. So again, it's a client choice type of model where people have the ability to select what they want as opposed to being given a prepackaged box of food, right? But the way they think about mobile distribution is based on how many households are served. So in this example, this smaller scale mobile pantry, they say, okay, we target somewhere between 100 to 150 households, right? But they may do a larger distribution, which they call community distribution, where they'll take 6 truckloads of food out to like a parking lot and then serve roughly maybe 450 households. At least that's the target. So they think about mobile distribution at these different levels and scales. And in this situation, the goal is, at least for that community distribution, is to give out all the food. So food is not going to be dropped off at a neighboring partner agency, for example. Then if we look at West Alabama Food Bank, right, they have several different options to deal with the fact that they have a largely rural network, and people do not have a way to easily access the brick and mortar agencies that are resident in their network. So they have a smaller, what they call a mini mobile food pantry, where they go out and deliver food directly to seniors. And they also have a larger scale mobile pantry, and then they do something that's similar to community distributions, which is direct distribution, but the difference in that setting is that they drive into multiple communities. So they'll load up the truck, they'll go to multiple communities and then return back to the warehouse. So that whole idea of a mobile pantry, right? Different meaning, different, terminology that's used, but the idea is the same. It's mobile distribution, it's moving food closer to the people. The strategy that's employed is dependent on the structure and environment of the particular food bank. Okay, and actually, I'm done.
Hello, everyone. So now we are going to take a deep dive into the decisions that are made by the food banks and their goals and challenges that they face when they are making those decisions. So the decisions that food banks make can be broadly classified under three categories: strategic decisions, planning or tactical decisions, and operational decisions. So strategic decisions are, they usually establish the overall structure of the network, and they determine the capacities under which the subsequent phases must operate under. So these are more high-level decisions, such as capacity expansions or technology upgrades, and food banks' main goals in making these decisions are to remove barriers to equitable distribution, enable collection of more nutritious food, and be resilient against disruptions. So planning decisions they have shorter time frames, so usually about a year or a quarter, and these are more middle-level decisions involving issues such as food sourcing, identifying locations of pop-up distributions, determining the allocation of food in their area. And food banks' goals for these are to improve the matching of supply and demand while considering the needs and preferences of their beneficiaries. And finally, operational decisions involve the day-to-day operations of food banks, and these are lower-level decisions such as filling agency orders, scheduling volunteers, and scheduling the collection and delivery of food. And here, food banks mainly try to balance equity, efficiency, and effectiveness with adaptability and responsiveness, which I'll actually talk about more in a few slides. So based on our collaborations with our food bank partners, we have observed several instances where decisions at these different stages have occurred. And I want to give you some examples of those. So at the strategic level, for example, the Food Bank of Central and Eastern North Carolina have moved their warehouses in 5 of their branches to larger facilities. So this allowed them to distribute much more food and more nutritious, more healthier food, such that the amount of produce that they distributed has increased to 50%. Similarly, Lauren mentioned this, the Second Harvest Food Bank has moved to a new warehouse and also opened a new warehouse, an additional one, in order to reach their rural areas in a better way. And finally, let me see if this works. Yeah, the West Alabama Food Bank, their previous location suffered from having very small freezer space. So last year they moved to a new facility that allows them to achieve and receive and distribute more frozen and healthy food. So tactical decisions, first of all, involve food sourcing, because food banks want to source food in order to serve their beneficiaries in a better way and reach and meet their needs and preferences better. So food banks do this in several ways. One of them is the retail donations program. So for example, the Food Bank of Central and Eastern North Carolina they use the retail donations program to partner with retailers such as Walmart or Publix. And as a result of these partnerships, those retailers donate regularly to the food bank. So these can be things like donating a truckload of food every week. So it is common for food banks to receive the majority of their donations from sources like supermarkets, Feeding America, or the government. But West Alabama Food Bank is unique in the sense that the largest donations that they receive come from a food drive. So West Alabama Food Bank is located in Tuscaloosa, Alabama, which is where the University of Alabama is located. So it's a college town. And every year, there is a competition between the University of Alabama and Auburn University in terms of which university can collect more food donations. And in UA, this is called Beat Auburn, Beat Hunger. So during this time, it occurs during the holiday season, the food bank receives a huge spike in their donations, which is of course a good thing, but then they are faced with challenges such as how do they manage those large volume of donations that comes in, and how do they ensure that the donations that they receive are actually what the beneficiaries need. Another type of decision that occurs at the tactical level is allocating food to their service area. So some food banks, such as the Second Harvest Food Bank, use a tool called Link to Feed in order to manage those allocations and to achieve an equitable distribution, which I will talk about more. And then Lauren talked about pop-up markets, but deciding on the locations of those pop-up markets, so where do we place those pop-up markets, are also important decisions faced at this level. Finally, we also see operational day-to-day decisions. These can involve scheduling volunteers and assigning tasks to volunteers. For example, the Food Bank of Central and Eastern North Carolina has to manage 15,000 volunteers annually. So this is not a trivial task because they have to think about the preferences of the volunteers, in addition to the schedules, the work or school schedules of the volunteers, and they want to avoid volunteer fatigue, and they want to retain their volunteers. So this is not very easy to do. So of course, this also involves collecting the food from donors and distributing food to agencies. So food banks typically use their own truck fleet for both collection and delivery purposes. So problems like routing of those trucks is very important in order to act more efficiently. And it doesn't only end at the agency level, because there are some, as Lauren mentioned, there are some beneficiaries who may be transportation insecure, who may not have a car to travel to an agency, or they may be homebound or sick, so that prevents them to go to an agency. So food banks try to directly distribute to those beneficiaries. So for example, the Food Bank of Central and Eastern North Carolina has recently partnered with a delivery service to be able to do this. And lastly, here I want to talk about this app, Meal Connect. So Feeding America launched this app in 2014, and it allows food banks to participate in food rescue, which is different than the regular bulk donations that they receive. So the way this operates is a donor, which may be a grocery store or a restaurant, if they have a small donation that they want to donate, they post a picture of the donation on the app, and the food bank can see this donation, but then are faced with an important decision. Should the food bank rescue that food, or should they match that donation with an agency in their network and have them rescue the food? And if it's an agency, which agency is best for rescuing that food? So again, these are decisions that food banks make. All right, so typically when we talk about traditional supply chains, we talk about objectives like maximizing profit or minimizing lead time. Objectives like that are not relevant in food bank supply chains, and we typically talk about the objectives of equity, effectiveness, and efficiency, the triple E. Here, equity refers to the fair distribution of food to beneficiaries. So we don't want to have people residing in one area of the network to receive more food than people residing in another area. Food banks typically use a metric called the meals per person in need, or MPIN, which is calculated as the number of distributed meals in an area divided by the poverty population. And they measure their level of equity using this metric. For example, the Food Bank of Central and Eastern North Carolina, they track this metric through a monthly fair share report. Feeding America also currently uses this metric. But there are also, equity is multifaceted, so I've been talking about geographical equity, but there are also aspects involving demographic or socioeconomic equity, which I will not get into details, but those are also things that must be considered. Then we have effectiveness, which is typically defined as meeting the needs of the population or minimizing food waste. And we have efficiency, which is a cost-related metric. So even though food banks are nonprofits, they do want to minimize the cost of their operations so that they can use their limited budget to better serve their beneficiaries. And these three objectives form the iron triangle of hunger relief, and they actually create trade-offs with one another. Yes?
So these are definitely very amazing objectives of hunger relief, but for the food banks, which ones are the most important? And I feel that given, it's like the second question is also, given that these feels like they also fight each other, or sometimes they also don't, like for example, minimize food waste and cost of operations, probably they're operating, but and also needs of population and distribution beneficiaries, they also kind of like in line with one another. But which one is actually important, the most important?
That's an excellent question, and we actually have a paper just on that topic. And I can talk just about that topic for an hour, where we did a preference elicitation on those three metrics, and we tried to elicit food banks' preferences based on their historical distribution actions. And we saw that efficiency is actually more important than we thought it was, although equity is still very, very important. But yeah, great question. So let me talk a little bit about how these objectives create trade-offs. And I'm going to give very basic examples just to give you an idea of how these trade-offs occur. So let's assume we just focus on equity and don't care at all about the other two objectives. A trivial solution is let's not send any food, right? It's equitable, everybody received the same thing. But obviously, it's not effective. We were not able to meet the needs of the population. Let's assume I just focus on effectiveness. Now I will want to distribute all the food to whoever can take it, which can, of course, be unequitable, and it can be inefficient if we are distributing all the food to places that are far away. And finally, we have efficiency. So if I want to just minimize the cost, okay, I'm going to distribute everything to the closest areas, which is obviously not equitable, and it's not effective because, again, you are not meeting the needs of the entire population. So it's a complex problem. We need to think about all these three objectives together. And it's further complicated by several factors that are related to the supply, capacity, distribution, technology adoption, disruptions, and uncertainty, which I will talk briefly about now. So Lauren talked about capacity constraints a little bit, so I want to just briefly go over some of the important things here. So food banks observe capacity limitations at many different levels. We do see that the agency's capacities are the most critical one because, again, these are very small nonprofit locations. They don't have large storage capacities. But in addition to that, they sometimes have to pay shared maintenance fees to receive food from the food bank. So their finances also affect how much food that they can receive. And if we want to enforce equity in our area, and if there is an area where agencies do not have sufficient capacity to serve their beneficiaries, then we end up with bottleneck locations, which end up constraining the entire network. But in addition, food banks themselves also have transportation capacities. So I took these two pictures in the West Alabama Food Bank. So as you can see, these are large warehouses. But just because of the large volume of donations they receive, they still have storage limitations. And this may be even more pronounced for special storage requirement foods, such as refrigerated food or frozen food. In addition, food banks use, again, their own truck fleet to both collect the food and distribute the food, and it can be hard to reach very rural areas that might be far away, and people who are transportation insecure as well. And finally, I want to emphasize that this entire network is very heavily reliant on volunteers, both at the food bank level and the agency level. And it is very, so because it's highly reliant on volunteers, capacity is very uncertain at a lot of the times. And in addition, the truck drivers that they use must be commercially licensed, and food banks have trouble hiring and retaining truck drivers because they may not be able to pay the same salaries as their for-profit companies. Okay, so food banks also have challenges related to food sourcing and funding. As we already talked about, they are reliant heavily on donations, which may be monetary or in kind, and their supply is much lower than demand. So they must operate in an environment of very scarce resources, and they want to ensure that they want to meet the needs of their beneficiaries. However, it is challenging because the donated items that they receive may not always align with the need or dietary preferences of the beneficiaries. And this is mostly a push system. Food banks do collect orders from agencies sometimes, and they do try to meet those orders, but again, they may not be able to do so because they may not know what donations that they receive. So one thing that they do is they use their monetary donations for purchasing additional food. And they do that in order to compensate for the food items that they don't typically receive from donors. So those decisions, the food purchasing decisions, become very critical. So technology can be both opportunity and a challenge for food banks. We already talked about a couple of apps, the Meal Connect app and Link to Feed app that food banks can use. There are also other applications or software that food banks use to manage their inventory, collect information about beneficiaries, and so on. But I just want to emphasize here that food banks actually vary a lot in the spectrum of technology adoption. So there are food banks that are very advanced, that have their own analytics group, and they develop their own dashboards and so on. Whereas on the other end, we see food banks whose entire data is still on spreadsheets. So there is this high variability. But I also want to emphasize here that food bank managers typically prefer solutions that are easy to implement and interpretable over ones that are black box, because again, these decisions affect people's lives. All right, I want to talk briefly about disruptions, because unfortunately, food bank supply chains are affected significantly by disruptions. And supply chain disruptions are defined as any event that causes a disruption in the production, sale, or distribution of products. And they can occur for many reasons, such as natural disasters, public health crises, political events, labor strikes, and so on. And I want to give a couple of examples. So this picture is from a food bank in Asheville, North Carolina, right after the recent Hurricane Helene. And it might be a little harder to read, but it says basically everything inside, including the food meant to help those in need, was destroyed. And then their food assistance infrastructure has been completely destroyed. So this food bank, they completely lost their infrastructure to serve the people that needed it much more than they need during regular times. But not all disruptions are disasters. For example, a government shutdown in 2019 caused a spike in the demand of a food bank in DC area. And this stretched their resources to a limit. So after disruptions like these occur, food banks typically cope by either renting new equipment or new facilities or expanding their existing facilities. And COVID-19 pandemic also brought additional challenges, additional changes to the food bank network. So here on this picture, you see cars that were lined up to receive food from a food bank in Texas right after the pandemic hit. So as you can see, they saw this spike in demand, and unfortunately, they saw a significant drop in capacity. Because as we saw before, these organizations rely heavily on volunteers who are mostly elderly. So due to social distancing measures, volunteers could not come to food banks or the agencies. A lot of agencies had to shut down. So food banks had to distribute or meet a higher need with less resources. And in some states, the National Guard was activated to support those operations. And food banks did come up with some alternative solutions. For example, agencies moved from the client choice operating model, which is where people go to an agency and shop, again, for the food to a pre-pack environment where, as you can see in this top picture, they have moved all of their distribution to outdoors and are just handing out pre-packed boxes to the people in need. Some food banks use school buses and school drivers to directly deliver food to the neighborhoods in order to reach people. And also, of course, community distribution and mobile pantries were utilized a lot. The good thing was there was an increase in COVID-19 relief funding from the government that helped food banks purchase more food to compensate for the fact that their supply coming from their supermarket partners has actually dropped due to issues in supply chain. Okay, so Lauren already talked a lot about uncertainty, so I'm not going to get into this, but I just wanted to, again, emphasize that food banks observe uncertainty at many different levels in their network, including supply, capacity, and demand. Okay, with that.
Thanks, Erin. Now I'm going to briefly summarize the literature review we conducted. So we categorized those research papers into 3 areas: descriptive analytics, predictive analytics, and prescriptive analytics. So descriptive analytics studies basically answer the question, what has happened? And predictive analytics studies answer the question, what will happen? And prescriptive analytics studies try to answer the question, what should we do? So descriptive analytics studies usually use large data set to describe the relationship, discover the patterns, and identify the trends. So such relationship in supply chain stakeholders, including the relationship with the donors, the volunteers, partner agencies, and the people they serve. So we try to categorize the papers into the relationship they have with their stakeholders. And also we categorize those papers into one of the 3 decision phases Erin mentioned earlier. So predictive analytics studies align really well with the planning phase of the decision. Predictive models of the available food and the food needs, which corresponding to the supply and the demand, provide information for the decision makers for the food bank. So we categorize those papers into the problems they are addressing, whether it's supply or demand, as well as the techniques they utilized in their prediction model. The prescriptive analytics, in this area, optimization is a common technique, and we try to group those papers into the 3 decision phases. There are 2 common themes that we identify in those papers. The first one is the combination of equity, effectiveness, and efficiency, objective to measure performance. The second is, as Erin mentioned earlier, a lot of studies realized that the food bank lacked the IT resources. So the solutions, they wanted to find out the solutions that can be easily interpretable and easily implemented. So Lauren and Erin mentioned there are a lot of opportunities for the research community. Here, I'm trying to highlight some emerging opportunities and future research. So the fundamental decision food bank makes is how to get the food to people in need. We identified in this particular decision phase, there are 3 areas where the research community can contribute. So the first emergent opportunities is to identify the need. The second opportunity is identify the resources to meet the need. And the last one is to understand how to structure and adapt the network over time. So identifying the need consists of, we try to understand geographically where service must be provided and how service must be tailored to address the specific needs of the population. For instance, people might have specific cultural or dietary or health consideration. So research in geographic and access gap services in the services will provide those strategic decisions, such as network design. From the literature, we realized the strategic decisions related to work hasn't received enough attention, simply because it's not as easy as operation level or planning level. They can be relatively easily implemented. However, strategic decisions such as allocation problems of food bank and their partner agencies, as well as the capability expansion at the food bank level and partner agency levels will allow the food bank to work more equitably, effectively, and efficiently. There's also this issue of true demand. Better information about the true demand beyond the quantity of the food will allow the food banks to understand what their specific needs of their population. So for instance, we mentioned the cultural background, the dietary, and health considerations. More and more food banks are moving away from this like strictly poundage mentality in terms of equity. So they're considering each specific needs of their population. So you can see there are words like culturally meaningful, culturally relevant food. More and more food banks are shifting towards that way. Additionally, there are research that in the development of the tools to increase or support situational awareness is very important. We know food banks operate large volume data. How to mine those operational data with the publicly available data is of a strong interest to food bank decision makers, which create opportunity for the research community as well. So, how do we identify the resources that we can meet the needs of those we just discussed earlier? So, both Lauren and Aaron mentioned this upcoming option of mobile distribution. So traditionally, you have this donor to food bank branches and then to partner agencies, this model. But more and more food banks are trying to explore other alternatives, such as directly from the donors to the partner agencies, or even donors to the people they serve. So how do we explore those specific mobile distribution options for a particular food bank is of great interest. We noticed from the research papers, the resource utilization often use the combination of the equity, effectiveness, and efficiency objective to measure performance. However, most equitable distribution studies use only the geographic measure of equity, and we know that that is not good enough. So more and more food banks started exploring other dimensions of equity, such as what type of food the people really want, and not to mention their demographic characteristics. So especially the latter one indicate that more and more food banks is not satisfied with just providing emergency food assistance. So they really wanted to provide those culturally meaningful and consider the preferences of their population. Equity, so we know there are a lot of studies studying equitable distribution, and as Aaron mentioned earlier, equity often contradicted with other metrics such as effectiveness and efficiency. So multi-criteria optimization to study the trade-off is really of interest as well. Lastly, food banks experienced disruptions due to disasters. Aaron mentioned one recent example of Amana Food Bank in Asheville. They experienced that their infrastructure is totally destroyed. So nearby food bank in the feeding Carolinas, they're trying to assist the food bank. So how do we structure and adapt to those network over time so that we can be responsive to those evolving stakeholder needs in both the supply and demand? Because when disaster hits, the food bank often experience a surge in the demand. And we mentioned they have to deal with the potential closure of partner agencies as well as the infrastructure. So that's also one of the areas of interest. We're going to briefly talk about some decision support tools, and we're going to provide one example for each of the three areas: the descriptive analytics, the predictive analytics, as well as prescriptive analytics. So for the example we're going to talk about in descriptive analytics, is a project funded by National Science Foundation, the flexible, equitable, effective, and efficient distribution. We call it FEED. This work is a collaboration between North Carolina A&T State University, North Carolina State University, and the Performance Corporation. And we have Harry from Performance Corporation here. So the goal is to develop a smart system to explore the operations data of the food bank and provide the insights to help them to make informed decisions. One of the key components of this project is to develop a series of interactive dashboards. We do have a link here. We have a Tableau public site. We have those interactive dashboard. We try to help the food bank decision makers to understand how a particular partner agency shop their food in their food bank over time, what type of food they want, and what's the trend, and what counties receive what specific type of food item, and what is the relationship between the partner agency capacity and the food distribution, and what is the geographical and access gap in the service area. So those are the things we try to help by providing this interactive dashboard. Here's just an example of a agency monthly shopping interactive dashboard. So decision makers at food bank can select a particular partner agency and look at their shopping behavior over time, what type of food they wanted, and at which month. The bottom chart also provide those interactive features where if you hover over a particular data point, you will see the percentage of difference in terms of the storage type pounds comparing with the previous time period. So this is a quick example of a descriptive analytics. I'm going to give it to Lauren.
Okay, so this is an example of a predictive analytics support tool, and this was work done by my PhD student, who's graduated now, Dr. Ben Morrow, along with Stephen, and then our food bank collaborator, Nikki McCormick, who's the Vice President of Partnerships and Programs. And so this project is really, and it's recently published in the Journal of Humanitarian Logistics and Supply Chain Management. This project is an example of one of the things that Steve mentioned about emerging opportunities. So what the food bank was really interested in was trying to help agencies in their network transition to a client choice model. Part of that transition to client choice is trying to dismantle the perception that there's going to be like more waste in the system because the agencies aren't pushing like a prepackaged box of food to the individuals. So what we were trying to do was understand preferences, right, at an individual level, so you can get a true sense of what people want, okay? And so and then how do we take that information and integrate that into the sourcing decisions, both at the food pantry level and ultimately at the food bank level. So this is just a summary of the framework that was used by the students. So there was we basically went womb to tomb with this in terms of like the on-the-ground data collection, working with each of the agencies that were in our pilot study. So there were 3 agencies in the pilot study, 1 university pantry, and then 2 community pantries. So the student worked with each one of those to design the client preferences survey alongside our partner at the food bank. And then he distributed in those surveys and, like I said, on the ground work, actually collecting the data. And then from that data, he built a logistic regression model to try to understand what are some of the demographic characteristics that are associated with people's individual preferences for food, and eventually using that prediction model as a way to identify what people are likely to get when they visit a food pantry by putting those predictions of preferences into an optimization model. So we use the knapsack model to figure out what someone is gonna get based on maximizing the preferences of the individual clients. And I should mention that that individual sort of level prediction model, which is the knapsack model is kind of based on, is giving the amount that a person should get based on the item limits at the individual food type level, as well as the overall total amount of food they can receive when they get there. And so you can see research questions that we were trying to address at each phase of our solution approach. And so what were some of the key findings? At least from the logistic regression model, we were able to identify that gender and age were the most important predictors of client food preferences for the food pantries that were serving the public, whereas gender and religion were the two most important predictors of client food preferences for the university pantry. And then we developed, so like Steve mentioned earlier, it's important to take the results of our optimization model to try to develop these heuristics or rules of thumb that the food banks can use without having to install some software, optimization software. So we identified a heuristic approach to be able to predict the items that individuals will pick, and then we roll that up across clients to figure out what the preferences for food items look like at a pantry level, and then we can roll up at the pantry level what that would look like for the food bank, so then they have a sense for what kind of items they should try to source, particularly if they're items that they're not getting through their donation process. And they can source that in multiple ways. So as I mentioned before, they have monetary donations that they can use to actually go out and purchase items, as well as they can provide recommended items for donation lists to also influence the amount of and the types of food that's coming into the food bank. And as a result of our study on the 3 pantries, they have launched it into their wider network so that we have like a running survey now that we can constantly collect the data and present that data to them. And you can't really see that dashboard in detail, but you can see it in the paper. But just wanted to let you know that we designed a dashboard, and we did that collaboratively with our food bank partner over several iterations. So that the key thing here is that this was a collaborative effort. It wasn't like us just getting the problem from them, coming up with a solution, and not involving them in the process at all. So thank you.
So lastly, I'm going to talk about a decision support tool where we use prescriptive analytics or optimization. Yes?
So that depends on the type of food bank. So for example, Second Harvest has a model right now where they prepare the boxes and the agencies get prepackaged boxes. So they don't really get to pick. They're trying to transition to a model that's similar to what's used in other food banks where agencies do pick the items that they want. So again, it's that one food bank may operate one way, one food bank operates a different way. Yep.
And I wanted to add, so for example, in West Alabama Food Bank, it's more like a mix. They do collect orders from their agencies and they try to match the orders, but I mean, the agency may have asked for strawberries and they don't have it, so they put in like maybe blueberries. So, so they may not be able to match them. So there's like, you know, hybrid approaches or either 2 approaches all exist. So. All right, lastly, I wanted to talk about a decision support tool where we use prescriptive analytics or optimization. The title of this work was Equitable Distribution of Perishable Items in a Food Bank Supply Chain. And this paper was published in Production Operations Management Journal, and it is joint work with my colleague, Dr. Emmett Laudry, who's not here today. So in this work, we focused on perishable food items like produce, and we asked how should a food bank allocate perishable food items, considering things like we want to minimize the food waste while trying to preserve equity, and we also have limited agency capacities, and we consider a multi-period planning horizon where different products deteriorate at different rates. So I'm going to give a very high-level overview of this study. Our focus was on the distribution between the food bank to their partner agencies. And our research questions were, one, are substantial deviations from perfect equity required to minimize the food waste for perishable goods? Two, how should the target deviations from perfect equity be managed to balance the equity effectiveness trade-off? And three, can food banks achieve equity based on quantity and quality, where we measure quality in terms of freshness in this study, or is there a trade-off between the two? So here we were asking the question, if two people in different areas receive the same amount of food, but one has received completely fresh food, whereas the other one has received food that is almost spoiled, is that really equitable? So we developed a multi-period, multi-product linear program, and we also compared two different ways of relaxing equity, where with one, we are aiming for small deviations in equity with every distribution, and two, we are looking at a solution where food bank achieves equity over multiple periods rather than every single period. And we performed a case study using our partners' data. So just I'm going to give you some ideas about the insights that we received by revisiting our research questions. So the first one was, do we need substantial deviations from equity? And the answer is no. We actually found that even if we make very small deviations in equity, we can achieve very meaningful improvements in food waste. Then we said, okay, how do those target deviations be managed across the network? So it's a little harder to see here, but these are the service area of the Food Bank of Central and Eastern North Carolina, and darker areas represent higher deviation from perfect equity. So basically, we found that if food banks focus on only a few areas and deviate from equity a little bit, they are able to minimize their food waste. And we also found that small deviations every period or with every distribution gives us a better solution than trying to achieve equity over multiple periods. So it results in better equity and better food waste. And finally, in terms of this trade-off between the quality and quantity of equity in quality versus quantity, we found that there's actually a trade-off between these two different equity metrics, and that equity is actually harder to achieve for quantity-based equity than it is for quality-based equity. And again, this was a high overview. Please see our paper for details. So to conclude our tutorial, I would like to just highlight that you have seen us talk a lot about how food banks' supply chains are multifaceted and they're very complex. They involve multiple stakeholders, conflicting objectives, various sources of uncertainty. We have seen studies in this area grow in the recent years, but there are still a lot of problems that are suitable for OROM research. And I wanted to leave you with this saying that Lauren mentioned. If you know one food bank, you know one food bank. So basically what that means is when you are working with a food bank, we should all try to understand their specific, their unique challenges, their unique goals, and build our models accordingly. And thank you for listening. I just wanted to put so we like that picture because it is from 15 years ago when we first started working with our food bank partners, and we all look very young in that picture. So thank you for listening, and we can get any questions you might have.